I'm Dr. Joshua Huffman. I'm a board-certified chiropractic neurologist. I'm also a diplomate of the American Association of Integrative Medicine. I'm the author of this book, Growing Young. I own a private practice in Mounds View, Minnesota called Mounds View Chiropractic. Today what I'm here to talk to you about is IBS, Irritable Bowel Syndrome, ulcerative colitis, Crohn's disease, digestive disorders in general. I know that if you're watching this video, either you or someone you love is suffering from some sort of digestive issue. And I know it can be a very frustrating thing. You know, I know from personal experience with family members that that many times help is sought and they're basically told and labeled with, you know, IBS and told, you know, you're going to have a sensitive stomach, you can take these medications to try to relieve the discomfort, but nothing more is done for them. And they continue to struggle, and many times it affects, you know, your ability to go out, to go on vacations, because of a fear of how your digestive system is going to hold up. And so this is something in my office that we see every day, and it's something that we have great success working with patients that suffer from these types of disorders. And today what I want to do in this video is explain to you why we have such great success, why we can get you answers, and what's unique about our program. So in getting started, the very first thing I'll tell you is what's unique about our program is that we take a very, very comprehensive approach to your care. We're going to support you both neurologically and metabolically. And this is very imperative because as we're going to talk about today, with digestive disorders, there's two parts to the equation. There really is a neurologic component as well as the metabolic side of things. And so very important that we evaluate and look at both so we can properly support you. Now with IBS, with Crohn's, with ulcerative colitis, it all starts with proper lab testing. The bottom line is with patients that come in with these disorders, they have not had the appropriate testing that needs to be run. Very first thing that needs to be done is we always want to do a metabolic panel. We need to look at just a general picture of where your overall health status is. We have to assess for things such as anemia, blood sugar issues, fatty acid metabolism, triglyceride status. Okay? If we find areas of deficit in any of these things have to be restored in order to give your body the best chance of recovering. You see, glucose and oxygen are the two primary fuels for every cell in your body. And so if you're not managing those effectively, you're not going to heal, you're not going to get better no matter what we do. And so it all starts with making sure that we're laying the foundation to build on. Secondly, we have to run food sensitivity testing. I can tell you, I have patients all the time that come in with IBS and they tell me, I've been tested for allergies, I don't have any food allergies. What I can tell you is we do not look at food allergies. Food allergies are dictated by an IgE reaction. This is an immediate response reaction, it's a histamine reaction. What this means is that if you have an IgE allergy to a food, you're going to have an immediate reaction to that food where you may break out in hives, you may have some swelling in the throat, these types of symptoms. That is not what we're concerned about in your case. What we're concerned about are what are called IgA and IgG mediated reactions. These are considered food intolerances, okay, or food reactivity. What these do is these are delayed response allergies, meaning when you consume the food, your reaction can be anywhere from 6 to 72 hours after you eat the food. You can see how this would make it a very muddied picture if you eat something that your body reacts to, but you don't get your upset stomach or your symptoms until 2 days later. This is what we want to look at. And so some common trigger foods that we look at are gluten, dairy, soy, yeast, egg, corn. These are all common foods that can be triggering these underlying immune responses. What happens is if you're intolerant to one of these foods, every time you eat the food, you create inflammation in the gut, which is going to create a vicious cycle. So it's going to continue to get worse and worse and worse. Not only that, but when 70% of your immune system is in your gut. What I'm telling you is that if you suffer from IBS, from Crohn's, from ulcerative colitis, you already know you have poor gut function. And it is so important to find out what is causing this because your immune system is compromised as a result of these disorders. Crohn's and ulcerative colitis, we already know, are autoimmune diseases. But IBS is one condition that I would also consider to be an indicator of a possible autoimmune reaction within the body. And so we need to dig deeper to find out for sure, is your immune system crossing that gap and starting to attack your own body? That's what an autoimmune disease is. It's where your immune system actually turns on yourself and starts to attack your own body. And this can spread throughout the body, creating more and more problems. This is why, just being told you have IBS and just try to manage it, manage the symptoms, is not a good long-term solution for you, because you're going to continue to have more and more health problems as you age. And so it's very important that we get to the bottom of this. It starts with that food sensitivity testing, identifying any types of reactions in the gut that could be perpetuating an abnormal immune attack on your tissue. Secondly, we also have to look at different types of infections in the gut. Do you have any bacterial infections that are promoting issues? Do you have parasitic infections, fungal infections, yeast overgrowths that are creating, again, another inflammatory reaction? It's not uncommon for me to find in patients that have IBS or Crohn's or ulcerative colitis a combination of both food sensitivities and underlying infections, for the very reason we already mentioned. That is, when you have these gut issues, your immune system is going to become suppressed, and you're going to be more prone to developing further issues. Another test that I consider a must-have for patients that suffer from these disorders is an adrenal stress index. The adrenal stress index is a stress test for your stress glands. Okay, the adrenal glands sit right on top of your kidneys, and they're what are responsible for reacting to stress. Now, what I can tell you is when you have IBS or Crohn's, you know that your body is under stress, right? And so this test is really imperative, because this test can account for many of the other symptoms that go along with IBS. For instance, your adrenal glands, if they're under stress, will release a hormone called cortisol. Cortisol will affect your ability to burn fat. It'll affect your ability to sleep through the night, to have energy throughout the day. And so many patients that I see with IBS, they have no energy, they don't sleep well, they're up multiple times throughout the night, they can't lose weight if they're trying to, okay? Or they can't put on weight. All of these are symptoms of adrenal dysfunction and adrenal failure. And so it's very important that we look at the adrenal stress index to identify this. Lastly, we have to look at the immune system. Okay, we talked about the relation between the gut and the immune system, but we actually have to run immune panels to find out, are you autoimmune? Do you have an immune system attack against your own tissues? If you're autoimmune, that means that your immune system is shifted and you have an imbalance in your immune system, which is creating damage to your own tissue. We have to look at all the factors so we can understand how to support your immune system in order to get you well again. Now, on the other side of things, we have to look at the neurologic picture. Okay, and the area that I find so imperative, and this is where being a chiropractic neurologist comes in, is we identify areas in the brain that have been affected many times because of your immune system. So if you have some underlying autoimmune response, this can damage areas in the brain as well. And so we find that the brain is compromised in certain areas. And what we want to do is find and identify areas of weakness in the brain. My primary level of concern for most patients that suffer from IBS is your lower brainstem and what's called the pons and the medulla. And we have what's called the pontomedullary reticular formation. These are just big words, but basically in this area of the brainstem is the area that the vagus nerve comes out of. And the vagus nerve regulates your parasympathetic function of all your organ systems, including your stomach and your colon, your small intestine. And so if this area in your brainstem is not working as it should, you're going to lose parasympathetic dominance, parasympathetic regulation, which is the healthy form of regulation over your digestive system, and you begin to rely on your sympathetic system to manage your digestive function. And this is going to cause fluctuations of diarrhea, constipation, okay, where you can go back and forth, or you may just have one. But very, very important to look at the health of the brain to make sure we're managing this appropriately. Now, in closing, I don't want to make this an exhaustive video for you, but I just wanted to give you some basic facts of how we approach your case. The bottom line is if you're suffering with IBS, with Crohn's, with ulcerative colitis, with celiac disease, with any of these disorders and aren't getting the answers that you're looking for, I encourage you, please follow up with us, come into our office, and we will continue to dig as deep as we need to get you the answers as far as what is driving this condition for you, how can we support you, how can we help you get your life back. Take into consideration how this is affecting you. You know, what are the things that you're not able to do now or are afraid to do because of the condition you're suffering with? How is it affecting your family, the time you spend with your friends? How is it impacting your day-to-day life? Okay, if it is still affecting your life at this point, it is imperative that you change something. Okay, I always say insanity, and this is a quote, you know, insanity is doing the same thing over and over again and expecting a different result. Okay, it's imperative that you make a change. Do something different. That's what we offer at our clinic. I encourage you, view our website, listen to some of the testimonial videos we have up, and I hope to meet you in the future very soon. Thank you, and God bless.